As a continuation of the previous video, we'll be seeing what are the non-surgical treatment options for the knee pain at Painex Pain Management Clinic. So dear friends, there are different non-surgical options for the knee pain. Especially I'm talking about the age-related knee pain. When the patient comes early to us in the initial stage of the degeneration, when there starts the pain, then what we do is we can do a prolotherapy, or we can go for the platelet-rich plasma therapy, or we can go for the BMAC. These are the basically injections which we take from your blood. We separate that part, either platelets or bone marrow, and we put that part into your knee joint, giving an injection. So what happens is there is a very much growth factor into the platelets and BMAC. So these growth factors increases the inflammation over the knee, and this inflammation causes a regeneration of the knee joint. This is one option, and this is very good for the early changes, those patients who have got the early changes. It usually doesn't work when the changes are too advanced. Another, even these options like prolotherapy, PRP and BMAC therapies, this works in the partial meniscal tear or the partial ligament injury where the knee pain is there and the surgery is not advised. Now, ablation, in which what we do is cool radiofrequency ablation. The 3 or 4 sides of the knee are supplied by the nerves. So those nerves, we do something called as cool radiofrequency ablation. In this part, we give an injection to that part, and that injection, that needle is attached to the specialized machine which hits that nerve to 60-degree temperature for 2 and 2.5 minutes. This procedure is done in stage 1, stage 2 osteoarthritis knee. Also, those patients who are unfit for surgery and those need a replacement, but the risk in doing knee replacement is very high. In these patients also cool radiofrequency ablation is done. Even this is done as a bridging therapy, like the knee replacement is avoided, but you want, for some reason you want some gap between the knee replacement surgery and present situation. Even that cool radiofrequency ablation is done. Even the post-TKR, the post-replacement knee pain, which is around 5 to 15% of the patient can suffer, the cool radiofrequency ablation is one of the best option. Even injection of the oil into the joint and the combination of all can be done in selected patients. Thank you, friends.